Hello there, my name is Sue Wong. I'm a registered nurse. I'm one of the facilitators at UTS. You'll be watching a role play and it's a typical scenario that you may experience when you go out on a clinical placement. You'll be watching an interaction between myself, the student and the patient. So when you watch the video, hopefully you'll gain something from it. Take it with you when you go out on your clinical placement and enjoy and have fun.
Hi, my name is Razia Zahidi. I'm a third-year nursing student. I'll be role-playing a first-year nursing student. So hopefully you'll pick up some ideas about how to communicate with patients and other nurses.
I am Jeanette Bryant. I am in hospital after having a knee replacement.
My name is Raymond Bryant. I am here to see my wife Jeanette to see how she's going.
Hello, Mrs. Bryant.
Oh, good morning. How are you?
Good, how are you?
Not too bad, thank you.
My name is Razia Zahidi. I'm a first-year student from UTS. I'm working with my facilitator today. We'll be looking...
Good morning.
My name is Sue Wong.
Good, and I'm Jeanette.
Hello Jeanette.
Nice to see you.
We're going to be looking after you today.
Oh, thank you.
Okay. There's lovely flowers you got there.
Aren't they nice?
Did you get them for her? Oh, how sweet. I understand that you've had a knee replacement.
That's right.
Yeah. How's that going?
Oh, not too bad.
Yeah?
Yeah.
Okay. I'm just going to ask you just routine questions
Right.
about your knee. Have you been experiencing any pain?
Yes.
Yeah? So it's just on your knees?
Yeah.
And yeah. Okay. So with a scale of 0 to 10, 10 being the worst pain you've ever experienced, what would you rate that?
I think around about a 6.
About a 6. Okay. Well, it seems like it's a bit of a pain.
Yeah.
When did you first start getting it?
When I got back in bed, you have to have been up yesterday. It started to. You know.
Okay. Okay. And how would you describe the pain?
It's around the knee, and when I move it, it's quite severe.
Okay.
I think I need something for it, really.
Yeah. Okay. How would you describe it? Generally, people describe it as, into categories as either dull or aching, or throbbing. How would you describe that?
I'd say aching. You're aware of it.
Okay, we're going to have a look at what we can do for you. The physio is going to come around later, and they're probably going to have you to walk around and do a bit of exercises with the knee. Okay, and we'll see what we can do with the pain relief.
All right.
We'll have a look on your medication chart to see what the doctors have ordered for you. Okay, he's ordered Panadol or Panadine Forward. Which one would you prefer?
I think the way it is at the moment, I need Panadine Forward.
All right then. Okay, we'll go and get that for you. We won't be too long.
All right.
Okay. Have you got hold of your buzzer there?
I think so.
Okay.
Could you pass it to me, please, Ray? Thank you.
So yeah, just call us if you need us in the meantime.
All
But
right.
we'll go and get it, and we won't be too long.
Okay, thank you.
Okay, thank you.
Okay. Now the patient has requested for Panadine Forte for her knee, for the pain in her knee.
Right.
So the order is for Panadine Forte, 1 tablet, and it's been signed and it's printed, doctor's print. Okay. Caroline here, she's a registered nurse, so when you check out a medication from a drug cupboard, you must have 2 registered nurses or an endorsed nurse to check the medication out with you.
Yep.
Okay?
Okay.
Great. So what do you know about Panadine Forte, Razia?
All I know is it's an analgesic. Yeah.
So if you wanted to find out more about a drug that you're giving to a patient, where would you go to find that information?
We use the rooms.
Do you want to have a look for it and see
Sure,
what you can
yeah.
find out whilst we're getting the drug out of the cupboard? I'm going to look it up in this book, which is the Schedule 4 book, which is the book that you sign the medications out. So we keep an eye on how many drugs are being given and where they're going to, so because they're sort of
Okay.
like ones we want to be careful with.
So I'll just have a look what it exactly does. Okay. So it's an analgesic and antipyretic for moderate and severe pain,
Do you know what an antipyretic is?
for fever. Yeah.
Perfect. Good. Okay.
So we've got the adverse effects are GI upset, constipation, drowsiness.
Yeah.
Yeah.
So
Okay.
when you give it to her, maybe if constipation is one of the big problems with Panadine Forte, so you might want to just talk to her a little bit about how to deal with that when we give it to her.
Okay.
Anyway, Sue's got the drug now, so let's have a look.
Okay, so I need to check it with Caroline. Panadine Forte expires 12/2012. Okay,
In the order, Panadine Forte, 1 tablet. Dr. Chang, due now.
yeah. I'm going to give her 1 tablet. So what we need to do is to make sure that the balance adds up.
And with the book I was showing you before, you just find the page, Panadine Forte, and it'll tell you how many there are in the cupboard. So there's 29 in the cupboard here. So we're going to check that now, and then we're going to check it after we've taken one out to make sure that the balance was correct.
All right.
Okay, so we've got 1, 2, 3, 4, 5, 6, 7.
Plus 1 is 29.
Okay.
Taking 1.
Need a medication cup?
So we might get you to write in this book in a minute, but have you used one of these before?
I have, yes.
Okay, so they're a bit tricky sometimes with funny shaped tablets.
So that's 1 tablet.
tablet,
1
yep.
tablet. Counting it again.
Okay. 1, 2, 3, 4, 5, 6, 7, which is 28 tablets.
28.
Okay. I'll write it down.
We just need to do one more check, which is against the medication chart. So
Panadine Forte. Okay. Panadine Forte. Mrs. Bryant. 2012.
That's right.
beautiful. So just fill
just
in
the date.
yeah, and the time, and then her full name.
Janet Bryant.
Yep. And then you just fill in the amount given column. So we're giving her 1. You can either write 1 or 500 milligrams because it's a 500
Okay.
milligram tablet.
And there's 28
28 left now. And just need to
Yes,
write the doctor's name who's prescribed
Okay,
it in that
so-
column there.
So that would be Dr. Chang.
Yep, that's Dr. Chen. Perfect.
Okay.
And I'm the witnessing person, so I'm going to sign there.
And I'm the one giving it, so there we go.
Okay.
And we can go and see her.
Thank
Great.
you.
Thanks.
Great.
Thanks, Caroline. Hello, Jeanette. We're back with your Panadine Forte.
Oh, thank you very much for that.
Caroline Hayes, who's one of the
Hi.
registered nurses on the ward, she's
Caroline.
with me because we need to check the medication out with 2 nurses. So, yeah. So what we've got here,
Okay.
we've got Panadine Forte.
Panadine Forte, yep. 500 milligrams. Are you going to check? Would you like to
Yeah.
check her name?
Sure. We're just going to ask you a few questions before we give you medication. Is that all right?
Yes.
Okay. Would you be able to tell me your full name?
Jeanette Bryant,
Jeanette Bryan, yeah? And your date of birth,
the 10th
please?
of the 2nd, 32.
Excellent. Are you allergic to anything?
Yes, penicillin.
Excellent. Okay.
Can we
So,
have a look at your ID band as well?
Yes.
Sorry, I've got to lean over you a little bit to see.
That's
Sorry.
all right.
Jeanette Bryan, 10th of the 2nd, 1932.
MRN 001 0012 001 0012. Perfect.
Okay. Now, I've got the tablet over here.
Right.
Did you want to sit up a little bit?
Yes, please, I do. Thank you.
the water.
Okay. Got it?
Yes, thanks. Thank you. That's right,
Did
thank
you
you.
get that down?
Thank you.
All right then.
Perfect.
Okay. Well, we'll come back in about half an hour to maybe 45 minutes to
Yeah.
see whether that Panadine has worked for you.
All right.
Okay. So in the meantime, if there's any other questions or any concern that you may have, you just give us a call on the buzzer.
Yes, all right.
Okay.
I've
Can you
got, I've
reach?
got the buzzer here.
Do you want
Thank
to
you.
sign?
Yep.
Thanks, Mrs. Bryant. See you, Mr. Bryant.
There we go.
Okay.
Thanks
Great.
a lot.
Thank you.
Bye.
Hey, Janet. Hello. Oh, it's been about 30 minutes now. Just checking up on you. Yep. How's the pain going now?
It seems to be going a little bit better than what it was.
Oh, that's good. That's good. Yeah. Just going to ask you a few questions again. Yeah. with the pain, from a scale of 0 to 10, what would you rate it now?
So it's gone down to about 2 now.
About 2. Oh, that's great. That's
Yes,
good.
it is.
Yeah, that's good. So we're going to have the physio coming around pretty soon.
Right.
Yeah, so that should help a lot. Yeah.
Oh, good. I've had some bad constipation though.
Have you now? Okay.
I was just wondering if it was the medication causing that.
Yeah, the medications sometimes do that as well, in particular with this medication. But generally it's other factors as well, like, lying down for too long and not moving around. Yeah, so, if you have a bit more water, drink more, we're going to speak to the dietitian to have some more fibre in your food. That should help it. Okay. Is there anything else you would like?
No, not just yet, thank you. I can always ring with that. If I need
Great.
it.
Okay.
Yeah.
We'll be out there if you need
All right,
us.
thank you very much, both of you.